session, we have two more wonderful and special items on our council agenda for the city manager report. Tonight, Chief Paul Bourgeois, Fire Chief from the Fire District, is here. He has a state of the district. Come on up, Chief. I will say that April is a special month for him. It will be his 4th year, believe it or not, as our fire chief. Once he's concluded, we'll invite Heather from our Public Works Department to give an update on the household hazardous waste event that we had a month ago. Chief?
Thank you. Mayor, Vice Mayor, members of Council, thank you for having me here this evening. I'm here because a few weeks ago I was reflecting on a lot of the wonderful things happening in my fire district, and I couldn't help but for a moment there I thought, what's it like for a city leader, a member of council, when someone from our community asks you a question about the fire district? And I thought for a moment that I bet many times they have to reply, I don't know. And I thought that was a pretty horrible position for you to be in as a city leader, and I thought I could do better. I reached out to City Manager Powell, and we discussed periodic updates such as this. So what we thought was maybe quarterly, I could come and share with you the latest happenings in the fire district, and City Manager Powell would come to the fire board meeting and share what's going on with the city. So we're here to bridge some gaps and hopefully provide you some insight and some visibility to the many wonderful things happening in our fire district. We are the other half of your public safety service, and we serve and support the same communities. So it's important as civic leaders that you see what we're doing. I'll take you through a brief presentation. The topics I'm going to review with you today, we'll very quickly review our mission, vision, and value statements that define us. We'll talk about our 60th anniversary as a fire district. I'll also introduce you to our community medicine program, the CM 263 we'll talk about. Talk about our new ambulance service. We'll talk about some new innovative medical care programs we have going on. A little fact sheet from our annual report. And we'll talk about our volunteer program as well, cover some upcoming events. First of all, the mission, vision, and values that define us. Our mission statement is, our mission is to preserve life, protect property, and add value to our community, quite simply. And our vision is to be the premier fire and medical district in the state of Arizona. That's a very important vision statement because it's not just a wall hanging. It's not just something we talk about when we cover meetings or give that in a presentation. Me and my people live by that. Everything we do, we hold to that benchmark of being the best. Our values are to be responsive, innovative, and professional, and I think what we'll discuss here in the next few minutes are reflective of that. First of all, our fire district was established in 1955, and in 2015 we celebrated our 60th anniversary. We're still within that 15-16 fiscal year, so we'll have some events coming up to commemorate our 60th year, but we're fairly old, and we've been around a while, and from our humble beginnings as a volunteer fire company to this cutting-edge, innovative fire district that we are today, it's been an incredible journey. I want to talk to you a little bit about our community medicine unit, or what we call CM 263. You've probably heard about this before, but I want to provide you a little bit more visibility and expose members of our community to this program as well. It's been well documented through our social media and also through local news outlets. But a couple of years ago, about a year and a half ago, we were granted a $12.5 million grant from the Centers for Medicare and Medicaid Services. That grant was written in conjunction with the City of Mesa Fire and Medical Department. And basically, we pitched to CMS, Centers for Medicare and Medicaid Services, that we had a program that we thought could save the healthcare system, just locally, $40 million. And we convinced them that if you give us $12.5 million, we think we can put up a program that will save the system $40 million. And quite simply, a year and a half into this, we've been doing just that. This grant was a 3-year study intended to save the healthcare industry $40 million. Again, we were granted $12.5 million over the course of 3 years. The majority of that money is funding the program on the Mesa side of things. We are supporting and servicing about a quarter, about 25% of that overall program, so $3 to $4 million. The CM unit, as we call it, the Community Medicine Unit, is staffed with one paramedic captain and one nurse practitioner. So nurse practitioners, or what you may have heard of in the past, physician's assistants, in the fire service is still a relatively new concept. Not so much here locally because of some of the innovation that's occurred around the valley. But we are utilizing a nurse practitioner, so I'll explain that more here in a little bit. The goal of this program, again, what we pitched to CMS, was that we felt we could reduce unnecessary ambulance transports. We felt that we could reduce unnecessary hospital admissions. We could better connect patients to their primary care physicians. Regardless of what you feel about the Affordable Care Act, one of the intentions of that legislation is to make the primary care physician central to patient care again. And we're helping to do that through this program. Additionally, our goal was to improve the overall quality of patient care being provided within the healthcare system, and also, as reflected in our mission statement, to add value to our community. Key components of our CM project, and what you see here in this photograph, is a member of our community who's being evaluated and treated by a nurse practitioner and a captain paramedic firefighter. So what we did with some of this grant money was we established a much more sophisticated 911 PSAP, a public safety answering point. And on the medical side of things, when the call comes into that alarm room, they decide is this a police emergency or a fire medical emergency. When it's determined it's a medical emergency, it's further triaged today, unlike in the past, where we would send a paramedic fire truck, code 3, to that in response to that call. Today, the medical call is further triaged, much like you'd be triaged in the emergency room to determine is this emergent or non-emergent. So with that, so we actually have a nurse now in the alarm room triaging medical calls. As soon as a call taker determines this is non-emergent, that call is immediately transferred to the nurse, who begins a whole different evaluation over the phone to determine what resource is appropriate. And in many cases, if it's a low acuity medical call, a non-emergent medical call, then our community medicine unit is the proper resource. Again, we're utilizing mid-level providers. So between us and Mesa, we have nurse practitioners and also physician's assistants. One of the questions that we get is, how do I contact the CM? And let me talk a little bit more about the program before I answer that. Quite frankly, we know that through the 911 system, not every call that comes in is an emergency. It's not at the highest level that we sometimes imagine, and there are low acuity requests that come in through our 911 system. And in the past, we had kind of a one-size-fits-all solution, and that was a 4-person engine company or ladder company equipped with firefighter paramedics, cross-trained, and that's how we answered that call. Today, we are able to respond in a much more versatile fashion, and we can take that low acuity call and provide a team of providers much more fitting to provide more in-depth treatment and evaluation, and provide comfort and care in your living room and avoid an unnecessary transport to the emergency room. So for example, right now in your living room, by virtue of having a nurse practitioner there, we can do a urinalysis and diagnose a urinary tract infection, and call in a prescription and get your prescription filled, and all in the comfort of your living room. We can suture. We have a lot of falls in our community, and sometimes people injure themselves, and lacerations are not uncommon. That nurse practitioner can actually suture, stitch you up, prescribe antibiotics and things of that nature, all in the comfort of your living room without unnecessarily taking you in an ambulance to an emergency room to clog the place up. So the question we get asked now all the time when people are introduced to this new concept, when they see it in the community, is how do I contact them? What's the phone number? Well, it's 911, quite simply. As I mentioned, when that call is received in the alarm room, the nurse now who is on duty will triage that call, and if in fact it is a low acuity medical call, this community medicine unit will be dispatched. So again, dial 911 and we'll triage you right there. Any questions on that program?
Of course.
Yeah, okay.
Is there a charge for the CMU?
No, there is no charge, and it's a great question because it leads us to the future of this program. I failed to mention that we're the only fire departments in the nation doing this, and we are piloting this for the rest of the American Fire Service. Just last week, LA County, for example, announced that they are doing this with a nurse practitioner vehicle exactly like ours. So we're seeing a lot of big and small cities around the country adopting programs like this. We're the only one funded by the federal government right now. The sole purpose of this grant and this pilot project was to define new billing codes, quite simply, define new billing codes so that fire departments in the future could be reimbursed for this level of service. The nice thing about being a government agency is I don't need to make a profit. I don't need to satisfy investors on Wall Street. If we simply break even to recover the costs, then we can continue to provide that high quality of service in the community. So currently there is no cost. At some point in time, we will hopefully be able to bill Medicaid and Medicare services, and that is in the works right now. Any other questions about that service?
I just have a quick one. Have you had any negative feedback from the medical community itself that are in the big box buildings?
Yeah.
That you're kind of at an unfair advantage now?
A little bit at first. It's really kind of convoluted, our healthcare system. So a little bit
Really?
in the beginning. Some resistance in certain places, but as things shake out, I think everyone is seeing, whether you're an insurance company or you own a hospital or you operate a home health care business, I think everyone's seeing there's a place for this, and this is a valuable component of a 21st century healthcare solution for our country. So in the beginning, yeah, there was some resistance because it was new. People didn't understand. As it begins to vet itself and we see this popping up in major cities around the U.S., people are realizing there's a place for this in the future.
Well, and I can see the great benefit too with so many people that even though we're required to have health insurance, we still don't, but they can still be served,
Yeah.
which is a great thing.
Right. Okay, I'll move on. Hopefully you've seen some of our new ambulances running around town. We, for a very long time, have been serviced by Rural Metro Corporation, and very, very recently we had an opportunity in the state for us to apply for our own license called a Certificate of Necessity. We applied for that through the Department of Health Services, the State Department of Health Services, and we're fortunate enough to be granted that license. And this has been 20 years in the making for us, but the political environment in the state wasn't always such that it was feasible for a fire department like ours to apply and be approved for this sort of license. But when that political environment changed, we jumped on the opportunity, and thanks to the good folks down at DHS, they recognized there was a need in this community, and that need, quite frankly, was to provide a sustained, high-quality ambulance service for this community. And today, we have that. We're very proud of this new service. I'll tell you a little bit about it. We are providing, through this service, now being a fire district-based service, providing you in our community the most advanced and the most progressive medical care available anywhere. We have 5 ambulances in our community on any given day. We have 3 in service, but we have 5 total units that we have. A couple of them are backup. We began January 4th of this year, so we've only been in operation a couple of months. This is an exciting new service for us, primarily because it's ours and we own it. And what I mean by that is the same team, same training, same equipment, same knowledge base, and the continuity of care from the time that the paramedic firefighters intervene at your home or at the scene to your transport, to your transfer to the emergency room personnel. It's the same team, and that continuity of care is so extremely important to ensure that our community members receive the best possible service from us. I was just having a discussion with the fire crew this afternoon over lunch about how incredibly important that has been since January 4th for us to all be in the same team, and how our patients, members of our community, are the sole beneficiaries of that. So This is an exciting service for us. Again, being government-based, we hope to, our plan is to break even. Again, we don't need to make money, cut corners, and cut training to satisfy investors on Wall Street like a public service does, a publicly owned, traded company. We're a government agency, and our bottom line is quality. And that's what we're all about, is providing the highest quality of service. And we think we've got a great model in place to service this community and sustain this service for decades to come. We're very, very proud of this. And I'll tell you something else. These are beautiful, beautiful vehicles if you've seen them around, so we're very proud of them. Innovative is one of our values, and we pride ourselves on being cutting edge. And I tell people all the time, if you live here in this community, you are the recipient of some of the most progressive medical and fire services anywhere in the nation. An example of that is where we're always pushing the envelope and moving forward is our recent acquisition of some new mechanical ventilators. And it may not seem like a big deal, you know, what is that? But mechanical ventilators are pretty cutting edge for pre-hospital providers in the fire service. We see ventilators in hospitals and emergency rooms and in operating rooms. But to equip paramedics with ventilators can provide an extremely high level of care to a patient who is in severe respiratory distress or even cardiac arrest, and I'll explain here in a little bit. The mechanical ventilator is a machine that assists a patient to breathe to reduce the need for invasive procedures such as intubation. If you watch medical programs on TV, you're probably familiar with intubation, but that's very invasive and has complications with it. This new equipment allows us to provide and assist ventilations for conscious patients as well as patients who are unconscious. And I had a firefighter medic tell me today, I said, tell me, you know, from your perspective, what's the best thing about this? He said, the ventilator doesn't have adrenaline pumping through it. And I said, that's a great way. I could relate to what he's saying, because, you know, when we're there and we're trying to help someone, and you've seen us use the bag valve, and we're bagging someone, you know, a big burly firefighter could be squeezing too hard or too fast, simply out of the emotion of the moment. And although we train for that, again, there's still a human factor. With the mechanical ventilator, however, when we apply that to a patient, the paramedics tune it to your body size and to the type of the emergency you're having, whether you're simply in respiratory distress or you're in respiratory arrest. And we can program the machine accordingly to ensure that you are getting the most effective respiration as possible. And what this does is this improves our ability to save your life. This improves your outcome as a potential patient. So it's very, very exciting, complicated machinery to introduce pre-hospital again. Again, we see ventilators in operating rooms, in emergency rooms, air medical transports, but we are one of the first fire districts in the nation to utilize a ventilator. The only other organization we know of is Mesa Fire and Medical. So we're a beneficiary, again, of being so close to another very progressive fire organization.
Have you seen the chest compression machines that they've come out with?
Yeah.
Is that going to be coming out?
We utilize those. Yeah, we utilize those as well. So we currently have 3 trainers on each shift, and there's a lot of training involved because, again, this is the kind of machine that respiratory therapists would use. So you know how much training and knowledge goes into that. So we are basically training our paramedics to be part-time respiratory therapists and utilize this very sophisticated piece of equipment. But again, we are providing a much higher level of care and service to our community today than we were just a few months ago before we had this. Just the facts. Here's a few things from our annual report that we want to catch you up on. If you see there to the left, that box, it says total incidents. Last year we had 9,093 calls for service. And that was a jump. That was an increase of 13% from the year before. And fact is, we are actually on pace to set another record. So last year was a record call volume year for us, over 9,000 calls. And this year we're on track to outpace that again. Not only did we set a record year in terms of call volume, but we actually reduced our response time. So one of the metrics we use to measure the effectiveness, the quality, the value of a fire organization is response times. and we decreased our response times 3% to 4 minutes and 44 seconds. And if you consider, as you well know, our fire district extends beyond the city boundaries into unincorporated areas of the county, as well as into Gold Canyon. We get into some pretty remote areas in our fire district. So to have a response time in the 4-minute range is pretty extraordinary. It's really a testament to the fact that we are very well positioned around our fire district. You see there in the middle our cardiac arrest survival rate. And if you do the neighborhood visits with us, you know this is a metric that we are very, very proud of. This is a metric that measures basically our ability to reverse death. This is a measurement of the percentage of time that my paramedics can show up on scene when someone is in cardiac arrest, cardiac and respiratory arrest. They are in fact clinically dead. They are not breathing and their heart is not beating. But they have one of two rhythms, ventricular fibrillation or ventricular tachycardia. And when our paramedics find them in that condition, 37.5% of the time we are able to reverse death. And that means that metric is a measurement of the patient's ability to walk out of the hospital under their own power. So when you consider how incredibly difficult it is to reverse death, I mean that's a pretty big request. And we're doing it at 37.5% of the time in this community. When I tell people that you are the recipient of some of the most effective and innovative medical services anywhere, it's metrics like this that I'm referring to. We're very, very proud of that, and that metric, that measurement seems to be going up. It's trending upward. That's a testament to things like ventilators and the cardiac thumpers and these medical innovations that we continue to strive for. We push our paramedics to make sure that they have the highest quality training. And when we say innovative and cutting edge, again, this isn't just window dressing terms. These are the things that we are doing, and some of these numbers reflect that. CCR demonstrations, that's hands-only CPR, basically. You've heard of that. Last year we trained over 700 members in our community. And if you know me, I'm always pushing the organization. And my team of people that are very proud to tell me, hey, we trained 700 people. And I said, great, next year you're going to do over 1,000. So I set a goal. They've already beat that goal. So very, very proud of them and their efforts. They've connected now with over 1,000 community members to now train them in hands-only CPR. When I point to a metric of 37.5% survival rate, that's not only a testament to the equipment and the training that we provide our firefighters, but to the training that we've equipped our community members with, primarily hands-only CPR. The more people we have in our community trained in hands-only CPR, the higher our survival rate will be as a community. So that sort of training is very, very important to survivability as well.
And I don't know if the folks can see it up there, but the national rate is 9.5%.
Yeah, thank you. Thank you. Yeah, the print is small, and thank you for pointing that out, Councilmember Waldron. In our community, our survival rate is 37.5, the national average being 9%. So it's really pretty extraordinary when you consider us to that national average. We have a relatively new volunteer program, only maybe 6-8 months old, but we're bringing in volunteers to help in virtually every corner, every facet of the organization. So a lot of opportunities there. We want to make everyone aware of that, from administrative services to community services like training people on hands-only CPR, all kinds of operational support, a lot of opportunities for people in our community to volunteer. I know Chief Kelly and his police department have a very robust volunteer program, but for those community members that think they might want to assist the fire district, there's opportunities with us as well. So be following us on social media, sign up for our email list, or just keep your eye out otherwise, or contact us. Check our webpage, and there's opportunities to hear more about our volunteer programs. What's new and what's coming up? April Pools Day that we do in conjunction, partnership with the city, and Miss Liz will be helping us with that, Parks and Rec. We do that every year, and it's always a great event for this community. But also EMS Week, and as an organization that prides itself, as a fire district, a fire and medical district that prides itself on extremely innovative medical services, we take EMS Week here. This is a national week. but we take that very seriously here. So we're going to take that opportunity to try to connect with our community members and provide some visibility to all the amazing things that paramedics do. People are astonished when they learn what a 21st century modern day and progressive paramedic is doing in their community. So there'll be opportunities for that. We'll have various events over the course of next year. This event will be at Superstition Springs Mall, and you can follow us and see everything there May 14th. And with that, I'll entertain any questions.
I think you said it all, but any questions?
I just have one comment. I was one of the 9,093 fire calls that was made in 2015. And growing up in a small community where we had volunteer fire departments, it was always, because everyone knew so many people in the community, when the fire whistle went off, you followed the fire truck to find out where the fire was, which seems absolutely ludicrous at this point. But when a house that I own in Mesa had a kitchen fire, my daughter called me, the house is on fire. And it was the first time in my life when I followed the fire trucks to my house, which was really a weird sensation. But the incredible job that your team responded, it was just a miracle that the entire house didn't go up, and how they, Mesa came in behind you guys. And so I was very proud.
Yeah.
Great job.
Jeff?
I don't know if I speak for anybody else, but I'm a little worried that you're doing all these innovative things and some big city's going to come in and hire you and the leadership away, and then we'll be without you, so.
I don't think so. I think Paul's got a lot more integrity than that.
Well,
And his services.
I love this city and I love this community, and I tell everybody I came here because I wanted to be here. And,
Thank you for that.
My wife and I are selling our home, and we hope to be residents in this community. We believe in it and we love it that much.
Cool.
Any questions?
Thank you.
Yeah. Thank you.
Paul, thank you very much.
Thank you, Chief. Appreciate it very much for coming in, and appreciate that update. Heather, come on.